Hi guys, Andy here. I'll be doing a baseline assessment with a client here. So first we're gonna be doing his resting heart rate. So first we're gonna have the patient's arm. I'm gonna palpate the radial pulse. All right, I found it. And for this measurement, I'm gonna be doing it for 30 seconds. I'm gonna multiply it by 2. Okay. So I'm gonna start it now. So I got 33, so that'll be 66 beats per minute. I forgot to note actually that it is important that they should be relaxed when you're doing this so you get an accurate resting heart rate. And I'll be doing his blood pressure. So I'm gonna have them arm out on the table. Same thing with this one, they should be relaxed as well. Then we're gonna put the cuff on over the brachial artery. Oh, sorry. I'm gonna palpate real quick to see if I can find it. Okay, yeah, it's right there. All right, put the dial on, and then we're gonna be releasing the air at a speed of 3 millimeters per mercury, or 3 millimeters of mercury per second. Okay, so. And you can bring it in for the dial. Okay, I got 120/80, so that's gonna be normal for him. All right, so now we're gonna be doing the Jackson-Pollock 3-side equation or assessment for his body fat composition. So we're gonna be doing sites at the chest, the abdomen, and the thigh. So for the chest, we're gonna do actually a measurement between the nipple and the axilla, and then that's going to be about 10, so then we would mark it at 5 here. Okay, there. And then for the navel, you're going to do 2 centimeters away. Okay, so right there. Okay, and then for the third one, we're going to do the thigh. So for this one, I'm going to ask my client to hold the tape and then place it on the crease of your leg, the inguinal crease. You're going to roll this up, and then we're going to do it to the kneecap. So it's when you're at 46, so it would be about 23. Okay, got it, thank you. Okay, so the first set we're going to do the chest. So we're going to do it about 3 inches, and then we're going to pinch the skin and then pull it away. Then we're gonna take the caliper. Okay, so that's about 14 millimeters. So now we're gonna release the caliper and then release the skin. Okay, so the next set we're gonna do is the abdomen. So here we go, we're gonna pinch and pull. And that one's at about 30 millimeters. Okay, now the last side we're gonna do is the thigh. We should have our client have our heel placed on something just to keep their quad relaxed. Okay, so I grab here, pinch and pull. This will be about 24 millimeters. Okay, so now we're going to be doing his waist to hip ratio. That's going to be the narrowest part of his torso, and then with the widest part of his buttocks. So first we're going to find probably right about here. And it's important to not make sure it's just snug, but you're not pulling it too tight. So okay, it's gonna be right about at 81 centimeters. Okay. Now we'll do his buttocks, or even his hip. So we're gonna find the widest part. And we got about 102 centimeters. Okay. Okay, so we're going to be doing a range of motion assessment now. So we're going to be doing 4 sites. We'll be doing shoulder flexion, elbow flexion, knee flexion, and hip flexion. So I'm going to demonstrate all 4 right now. We're going to start with shoulder flexion. So we're going to get on the table right here. We're going to be in the supine position. Arms to the side. And then we're just going to have the client have them raise their arm by their ear, just like that. Okay, so that'll be shoulder flexion. And then now we're going to do elbow flexion. Same thing, arm to the side. We're going to do palm up. And then we're going to be doing just like a bicep curl, just like that. Okay, so that's elbow flexion. And now for knee flexion, let me slide up a little bit. This one's just going to be pretty much just sliding your heel to your butt, just like that. Okay, and then for hip flexion, we're going to be doing a 90 degree, making a 90 degree with our leg, and then we're going to just bring it knees to chest, pretty much like that. Okay, all right, so we're going to be doing a shoulder flexion range of motion assessment. It is important to note that for all of these measurements, we normally would be done bilaterally, but for the sake of this video, we're going to be measuring just the right side. Okay, so first, the client's going to move their arm up, raise their arm up by the ear. Okay, so you're going to do that first. Go ahead, all the way, as far as you can go. Okay, so now I'm going to have the fulcrum, which is the middle of the goniometer, in the middle by the armpit. The stationary arm is going to be along the torso. Okay, and then we're going to move this. The moving arm should be aligned with the shaft of the humerus. So this looks about right. So that's going to be marked at about 160 degrees of shoulder flexion. Okay, so now we're going to be doing elbow flexion range of motion. So for this motion, he's just going to do like a little simple bicep curl. Okay, so he's going to do it. Okay, so now I'm going to have my fulcrum at probably about the lateral epicondyle. The stationary arm is going to be up the humerus, and then moving arm is going to be along with the radius. Okay, so that's going to be about 120 degrees of flexion. All right. Okay, so for now this assessment, it's going to be knee flexion. We're going to be measuring, or we're going to have the client just be doing a simple like slide their heel to their butt. So I'm going to perform the motion. There we go. So fulcrum is going to be on the lateral epicondyle of the the femur, sorry. And then the stationary arm is going to go along the shaft of the femur, while the moving arm is going to go along the fibula. And it's going to look about 120 degrees of flexion. Okay, so now the last range of motion assessment we're going to do is hip flexion. So we're going to find the greater trochanter first, as that's going to be where our fulcrum is going to go. It's going to be right about here. Okay, and then this motion he's going to be doing a just bringing his right knee to his chest. So he's going to do that. Okay, so the stationary arm is going to go along the torso, and this is going to go with the femur. Okay. This one's going to be about 95 right here, about 95 degrees of hip flexion. Okay, so now we're going to be doing a flexibility assessment. We're going to be using the YMCA St. Reach test. So you can see here laid out, I have a yardstick on the floor. I'm going to demonstrate it for you. So the tape is marked with the 15-inch with the yardstick, and that's going to be where our feet are going to be placed. First thing we're gonna do is we're gonna have our go straight up, and then we're gonna reach as far as we can go. Okay. And it's important when you're doing this that the fingers should be perfectly aligned and not like this overlapping each other, and that our legs are maintaining contact with the floor, or like our knees aren't bending, and we're not doing any like ballistic like reaching, making that extra reach for it. And it is important to mention that the client should warm up before doing this, having a proper warm up, proper stretching, and warm before performing this test. Okay, so now my client's going to perform the test, and we're going to do it 3 times, and then we're going to take the measurement of the biggest or the largest number of the tests. Okay, so perform. Okay, hands are overlapped. It's going to go straight. Okay, so that's going to be about at 11. Okay, so there's a reset. Okay. Jumped up to a little past 12. Okay. Maybe one more time. All right. This will be about 13. All right. Okay, so now we're going to be doing the ACSM push-up test for muscular endurance. So I'm going to demonstrate it here for you guys. We're going to start in the down or up position. It's going to be a standard push-up position. So our hands are going to be shoulder width apart. We're going to be on our toes using our toes as a pivotal point. And we're going to maintain a straight back, no arching of the back like that. And then we're going to descend just using our elbows. And then we're going to go up. So that's going to be 1 rep. The test will be continued until the client fatigues or cannot maintain proper form for 2 consecutive reps. Okay, so now we're going to start the test. I have my client here. He's going to start in the up position. All right, he's going to go at his own pace, so he's going to start whenever. Okay. That's 10. Okay, 20. Okay, so that was about 26. Okay, so now I'm going to be demonstrating the ACSM partial curl-up test for muscular endurance. So we have a mat laid out, and then I marked a piece of tape on it, marking the region. So this would be 12 centimeters. That will be for clients 45 and younger. If they're older than 45, we'll change it to 8 centimeters. So we're going to start in the supine position with our knees bent. And the first part of the tape will be where our fingertips are. So that'll be like our guideline right there. And then, so we're gonna have palms down as well. And then the test is performed at a metronome of 40 beats per minute. So during the first beat, we're gonna rise up using our trunk. And then we're gonna cross the tape right here to the second line. That's as far as we wanna go. And during the second beat, we're gonna go back down. And that's gonna be 1 repetition. So it can be going up to a maximum of 75. Some common mistakes include not reaching or not crossing the tape completely, or one side reaching over and the other side not. Another mistake would be when you're performing it, like if your feet come off the ground, or if you break the rhythm of the metronome. Okay, so we're going to start the test now. I'll have my client in position already. I'm going to start the metronome at 40 beats per minute, and then after the test, I'm going to be measuring his heart rate and blood pressure. Okay, so I'm going to start the metronome. That's 5. 10. $15. 20. 25. 30. 35. 40. Okay, done. All right, so now we're gonna measure his heart rate. Okay, I'll do it right now. Okay, so I got 42, so that would be 84. Okay, so now we're going to do blood pressure. So I got 130/100.